Hi everyone, it's Dr. Jhawar with Revive MD Direct Primary Care. It's still American Diabetes Month, and I wanted to share some information I was reading in an article. So there was a study done looking at type 2 diabetics who were also obese or overweight and comparing whether time-restricted eating or intermittent fasting versus just calorie reduction yielded better results in terms of weight loss and hemoglobin A1C results. Interestingly, this was a randomized control trial. It was a smaller study though, but it was very useful because it looked at these patients over a 6-month period and found that those who actually were in the time-restricted group or the intermittent fasting group yielded better results in terms of overall weight loss and hemoglobin A1C reduction. Majority of these patients were actually on average around 55 years of age, and most of them were female. So it's important to note that. But I think it's just, shedding more light on the fact that it's not just important, about what you eat, but also about when you're eating. And this applies really for diabetics, but also for those who are pre-diabetic, or who have risk for diabetes and heart disease in the future. So, I talk to a lot of my patients about when we eat is very important, and doing a sort of longer interval where your stomach gets a break from eating can be beneficial, not just for reducing your blood sugar, but also reducing your baseline insulin. Insulin is such an important hormone in our bodies, but having high insulin levels at baseline does actually cause, a more difficult time to lose weight. And in fact, it can actually cause you to gain weight. So when you reduce your insulin levels by doing an interval of fasting, you actually can get more fat loss to occur because your body starts using the fat stores to burn off for more fuel and energy. And that's what we want. So that's why fasting and intermittent fasting is something that a lot of people talk about. Now, doing too long of a fast is also not great for your body because it does slow down your metabolism. It's really hard to get in all your nutritional needs in like a 4-hour interval of eating time and a 20-hour fast. So I don't promote that kind of intermittent fasting, but something that's really healthy, and in this study, they did have patients who did the fasting. They were fasting for 16 hours, but they ate for 8 hours. So, that was actually a good way, a good model of intermittent fasting. And it's important to talk to your doctor about what kind of fasting schedule is good for you, or whether or not, a longer fast is safe for you, because those who are on insulin, it actually can be dangerous, and you don't want to have problems where you get hypoglycemic. So, it's really important to talk about fasting. It's really important to know when it's a good time to eat, and not just what you eat is important, but have these types of discussions with your doctor, especially if you're diabetic or pre-diabetic, okay? And I'll be back with more videos. Have a great night.